I'm Dr. Thilagavathi. I'm a senior consultant hematologist at Kuruthi hospitals. BMT is bone marrow transplantation, otherwise known as hematopoietic stem cell transplantation or stem cell transplantation. Bone marrow transplantation is of different types. It is either autologous transplantation or allogenic transplantation and syngeneic transplantation. What is autologous transplantation means the stem cells are taken from the patient himself or herself and given back to the patient when the patient is ready to receive it. Allogenic transplantation, the donor will be a different person where we can get normal, healthy, matched stem cells. Syngeneic transplantation is the donor will be from the identical twins. The bone marrow transplantation is a special therapy where it is used in many cancers, especially blood cancers like leukemias, lymphomas, multiple myeloma, and solitary bone tumors or even malignant tumors and non-malignant conditions. It may not be malignant, but non-malignant conditions like inherited bone marrow failure syndromes, especially in pediatric age group like Fanconi's anemia and aplastic anemia. Either it may be an adult or a child, the bone marrow transplantation is the cure. And many metabolic disorders, bone marrow transplantation is the curative mode of treatment. And also thalassemias and sickle cell disease, now at present bone marrow transplantation is the cure, though gene therapy is on the way. In allogenic transplantation, the crucial challenge is to choose a best suitable donor for the patient. So the donor can be either matched sibling donor or the matched related donor, or the matched unrelated donor will be the next ideal person. And if we are not able to get the totally matched donors from either a sibling or relation or an unrelated donor, partially matched donor can be the choice, and that partially matched donor can be from the relatives or from the unrelated donors. If nothing is possible, last but not the least will be the umbilical cord stem cells. So once we plan for the transplantation, we have to do a complete basic workup for the patient. The patient should be in an ideal condition to receive the different donor cells. And for that, the patient's condition should be all right. And for the suitable donor, tissue typing should be done like how we do for the blood transfusions. We have to get a suitable matched donor. So HLA matching should be done for both the donor and the recipient. And other blood biochemical workup is mandatory, including the cardiac evaluation, pulmonary status, and other comorbidities should be ruled out for both the patient and the recipient. The bone marrow transplantation, once it is decided, actually we have to prepare the patient to receive the foreign cells. So for that we have to do the conditioning process. The conditioning process consists of prior to the date of transfusion, it may be 1 to 10 days, which consists of either chemotherapy or both chemotherapy and radiotherapy or only chemotherapy. So it goes on for 1 to 10 days, and on the day of transfusion the patient is ready for receiving the stem cells from the allogenic or the autologous stem cells. And for the donor, what we have to do is, before harvesting the stem cells from the donor, we have to prepare the donor by giving granulocyte GCSF, that is colony stimulating factors, to increase the production of stem cells so that we get a good yield of stem cells for the patient to repopulate. So we have to prepare them by giving these injections for a minimum of 4 to 5 days. On day 5, from the donor, the stem cells are harvested from the bone marrow or from the peripheral blood. So from the bone marrow, we do it under general anesthesia over the iliac crest by multiple punctures, and from each in multiple aliquots, 3 to 4 ml of bone marrow aspirate is taken, and total of 200 to 250 ml of bone marrow aspiration is done and cryopreserved. So, and also we have to estimate the CD34 cells, that is stem cells, to assess the adequacy of the stem cells for the recipient. And if we are planning for a peripheral blood harvest, the peripheral blood is peripheral vein is cannulated like a femoral vein. It is cannulated and the patient is connected to the apheresis machine, and they go through the apheresis process and the stem cells are collected. And same way the adequacy of the stem cells are calculated and kept, and both whatever, either it is from the marrow or from the peripheral blood, the stem cells are cryopreserved until infusion. For the stem cell infusion, we have to calculate the dose of stem cells to be infused as per the recipient's body weight. So it is ideally 5 to 10 into 10 to the power of 6 per kg body weight of the recipient. This is for adequate functioning and adequacy of the engraftment. So we have to give the adequate dose of stem cells also, and that is given on the day of infusion, following which we expect engraftment to occur. It takes 2 to 4 weeks for the engraftment to occur because 3 cell lines are there. Initially, WBC starts taking up. That is called engraftment, where the donor cells starts functioning and repopulating and occupying the bone marrow of the recipient. Here, the engraftment starts at 10 to 14 days for the neutrophils, whereas for the platelets, it takes around 18 days to 21 days. So minimum of 2 to 4 weeks is allotted for engraftment phase. In this phase, the patient is neutropenic, and so they are at high risk for developing infections. Either it may be bacterial infections or viral infections. This period is a very crucial period where we have to ensure adequate hygiene is maintained, and everything should be taken and done under strict aseptic precautions, and prophylactic antibiotics may be required, prophylactic antiviral drugs may be required, and antifungal drugs also are required during this phase. So this engraftment phase or the neutropenic phase is the very crucial period for them to recover. So after 2 to 4 weeks, if they are in the hospital and if they recover from all these things, they can be discharged at the end of 4 weeks from the bone marrow unit, provided if they do not suffer from severe graft versus host disease. Minimum 4 weeks is required for transplant duration, and once after the stay as inpatient in BMT unit, they can be discharged with strict precautions and instructions to be followed, and they have to stay nearby where they can easily access to our hospital care at any time in case if the patient develops fever or any evidence for infections. And after 2 to 3 months, they can be allowed to be in their own places. The bone marrow cost for autologous transplantation, it is 10 to 12 lakhs, and for allogenic, it may be around 15 to 20 lakhs. And when the patient develops complications, it may even be as high as 40 to 50 lakhs.